Aurora. I'm Kushi.
Assalamu alaikum, vanakkam, I'm Hafi. So today we are having a beautiful episode, and it's not only a episode on entertainment, but it's an episode on knowledge. As we know, we have come to October, a month of breast cancer awareness, a month known as the Pink Month, because it gives a lot of importance to women and their health. So we've got two important guests with us from a different living room to your living room to tell you, to educate you, to highlight the importance of knowing the factors, the symptoms, the medications, and what you need to do, the procedures to do when you feel you're at risk. So let's welcome Dr. Kulsoom Junejo, a senior consultant on plastic breast surgery and an assistant professor of clinical surgery in Weill Cornell Medical College. She is trained in general surgery and specialized in breast surgery from UK, USA, and Europe. She is also a co-member of the breast multidisciplinary team in Hamad, also an associate director, breast fellowship program, Hamad Medical Corporation, corporate lead for physicians, CPD. Good evening, Doctor. Assalamu alaikum.
Good evening. Walaikum assalam. So, as Hafsa was saying, this month is very important, especially for us ladies, as everyone is knowing. Actually, we were just talking in our living room that we should not limit this breast cancer awareness to this month. At least we should give a start. That's what we are going to do this time. We are going to start it now, but please don't stop it. We have to continue this important awareness throughout the year. Okay, so I have with me Nurse Farzana Badshah. She's a clinical nurse specialist in breast surgical oncology at the Surgical Specialist Center at Hamad Medical Corporation. She has over 10 years expertise in the field.
So, as Tushi just mentioned, it is a month, and we have to realize as women, this is affecting us. It has been there for generations, and we cannot just only stop it after October. We have to continue on this journey, and that is why we have given a lot of importance to this topic this month. So, it is an honor to have you with us. Like I'm going to say it again. So, thank you so much for taking your time. And going straight to the questions, how would you, doctor, define breast cancer, and what are the main causes behind it, doctor?
Okay. First of all, thank you very much, Hafsa, and your team for inviting us for this interview. And you are doing a great job that you are helping our community to understand it better and help spread the message about it. I understand absolutely, as you said, this is the pink month of October, but we have to spread the message all the year, not just in October. And you people are the ambassadors of it. So, coming straight to your questions, that yes, what is a cancer? So the word cancer comes from the Greek word canker, and it is a crab-like. If you cut cancer in the middle, you will see that it has tentacles which is spread in the tissues. So it is just like a crab. So it was named after that, and with time it just changed to cancer. And it is an abnormal overgrowth of cells in human body. Normally, God has made us kind of foolproof. Any abnormal cells in a cell cycle, they are deleted from the cell cycle by autoregulation mechanisms which happen in our body. Due to certain factors, as you said, what are the causes and what could be the reasons for it? Certain factors, these mechanisms slow down or they are inhibited, and that is why the cells which become abnormal during the cycle, they keep growing, and when they grow, an abnormal mass of cells that is formed, which is called cancer, and which starts in any organ in the body, and then it can spread inside that organ and then further spreads through the blood vessels and special type of other vessels which are called lymphatics into the rest of the body.
So I'm going to ask you a question, doctor. We discussed the questions, but I felt because we're talking about women as well.
Absolutely.
And why do you say like this section of medicine, doctor? Why breast? What intrigued you to go into this topic, doctor?
Right. Okay, that is a very personal question. Okay, yeah.
Sorry.
No, absolutely fine. The thing is that I was always, when I was in a medical college, I was always fascinated by surgery. I have kind of temperaments that do it and khalas, that's it. Because when I did my initial internship in medicine, you can see the same patients on the same bed for quite a long time, and that was not my temperament. When I went to surgery, patient comes to you, you deal the problem, patient goes home happy, that's it. So that is why I just chose surgery for myself. And why breast surgery? Because I realized that working in a Muslim country, it is women, they don't like to go to men for their problems, for their problems of their private parts, and breast also. And so much so that I would say even in the West, when I was practicing in London, we did a survey and we found out that women were trying to go more to the female to have examination done. So that was kind of very interesting to find even in the West. So yeah, that is
I think I can relate, because we feel more comfortable with a woman to talk to, and I think that intrigued me, so I thought I just have to ask.
Sure. Yeah.
So going back to the topic,
yes.
How would you say, doctor, the breast cancer develops in a patient?
Yeah, as I already mentioned, it is an abnormal growth of cells. Now, what causes the abnormalities to come? There are various things. I'm just coming to the next step of our questions, that there are various factors which can really cause breast cancer. There are certain factors which are called modifiable risk factors, and certain are non-modifiable risk factors. And non-modifiable are that, yes, we are women, we have to have a more incidence of breast cancer, but having said that, that doesn't mean that men are immune to breast cancer. They can also get breast cancer. And secondly, increasing age, it is not in our hands. It is just that we have to age, and that is again, increasing age is a problem. Again, having said that, that doesn't mean that the young girls or they don't get breast cancer. Surprisingly, in Gulf region, we have breast cancer happening in age group which is 10 years younger than the Western population. So this is again very important. And and genetic factors, which are again non-modifiable risk factors, we cannot change our parents, but yes, we can change something which is the modifiable risk factors, and that is what your lifestyle changes come into. That is where you can change your diet, where you can change your lifestyle. So healthy lifestyle, more physical activity, that is going to help prevent from breast cancer. Stop smoking, stop processed foods, stop alcohol. If you can't stop, at least in moderation you can use. And external hormonal intake should be taken with the advice of your medical doctor, not to just take if and when you think it's needed. Okay.
I'm going to ask, now since we spoke about a medical question, I'm going to ask something, in our part of the world, in the Asian cultures, they believe in a lot of myths, doctor.
Sure.
And I've heard so many people saying, when I said that I'm going to do this question, they're like, oh, Hafsa, you need to ask this. Some people say wearing a tight bra or wearing a particular bra
Correct.
can make you get breast cancer, or not wearing a bra while sleeping or wearing a bra while sleeping, So do those have a part in breast cancer, doctor?
Very important question. These are the myths which circulate in our society, and these are very important to be addressed. No, bra has no relation with the breast cancer occurrence. Tight bra, no tight bra, loose bra, wearing it at night, wearing it in the day, doesn't matter. So much so that I heard one of the patients saying that in one of the countries, in a hospital, it was written that if you wear a black bra, you will get breast cancer, which is absolutely wrong. It is just, I don't know how people spread this kind of rumors and things, but these are definitely myths.
Because I just want to get those clarified, because we've got the specialist with us, doctor.
Sure.
So, what are the most common symptoms of breast cancer, or do you have particular symptoms that we need to be a bit wary about?
Right. Now, breast cancer, the most common symptom is a painless lump in the breast. And that is the most important thing, which I would say our ladies are not breast aware. They don't even touch their breast unless there is some pain or something, or they are hurt, there is a trauma, then they really realize, oh, we got some pain here, and then they examine. So this is the most common, is a painless lump. And then comes the changes of the skin, then comes a bloody nipple discharge, and pain happens in less than 2% of the cases. So pain is a very, very, very last in the list of the symptoms of breast cancer.
Thank you, doctor.
So now I have with me Mrs. Farzana Badshah. She's a clinical nurse specialist in breast surgical oncology at the Surgical Specialist Center, Hamad Medical Corporation. She has over 10 years of experience. So Mrs. Farzana Badshah, thank you so much for coming, and I welcome you warmly to the program.
Thank you so much for inviting me and giving me this opportunity to connect with all the women who will be seeing us.
And we were actually listening to the doctor. Doctor was giving very important information, and she was talking about the symptoms, right? So I would like to ask you first, if someone feel or think that you have symptoms, what should they do first?
Yes, this is very important that we know what is the next step. If you have any kind of a change or a symptoms that you are worried about, they have to be checked properly. You can go to any of your health centers in Qatar, or you can go to the private doctor who can check you, and if you still are worried, they will refer you to the Hamad Medical Corporation Breast Surgery Department.
Okay, so that was about the people who have symptoms, and we know it's common that you don't have any symptoms, or non-symptomatic women. So what is the general age group you think a screening should be done?
Okay, so the screening means that we don't have any, as a woman, you don't have any sign and symptoms, but you want to be checked so that we can detect the cancer earlier before any symptoms can develop. To check it earlier, you need to go for a mammogram. Mammogram is a special tool or an X-ray that we use to check the breasts. In Qatar, if you are about the age of 45, you have to go for a screening mammogram. And in Qatar, it is very easy to register for a mammogram. There is a special number where you can call. They will get your general information and they will book for you a screening mammogram in any of the nearest health center with your house. So the number that we are usually using is 800-11112. This is the screening number. Any woman about the age of 45 can go for a free mammogram through this number.
Okay, so as you were saying, anyone over 45 should be able to get a mammogram done, right?
Yes.
So how can one get screened?
Yeah, so this is the thing. So the thing is, for the woman above age of 45, you can easily go for a screening mammogram, and if it is normal, you'll be comfortable that okay, I have screened and I'm okay. And every 3 years you should repeat the screening. But for the women who are below the age of 45, that is when you say that okay, what should I do? So as we said that there are many different signs and symptoms, but as a woman, it is very important for us to be aware about our own body, especially about our breasts. And how to be aware about it is that you have to look and feel. First thing you have to look at any changes that are happening around your breast. And only you can do that if you know what is a normal breast look like. So you have to look for yourself, look in the mirror and see any changes that is happening around the breast area or under the armpit. And also you have to feel with your own palms and your fingertips. You can just feel if there is any hardness, any lump or any changes that you did not feel it before. So in that way you will be aware about what is the normal breast shape for you and what is the normal breast looks and feels for you. And if there is any changes happening, then you can obviously go and check it up in any of the nearest health centers or with your private doctor if needed.
Yeah, so that means you don't have to wait until you're 45.
Yes.
You have to
keep on checking. I think from very young ages, even it's better if you keep on checking, right?
Yes, in a very young age, even the young girls that are developing, their breast will be having some changes. They will have with the age. Like if you are in the 20s, and you have to start looking at any of the lumps or any of the changes. Definitely there will be some normal changes happening, but you have to be aware of this is the normal. And if there is any kind of things that is suspicious or that worries you that this is something that was not there before and it is coming now, or it is coming in one side and this is not something happening in both sides together, so it means you have to come forward and to be checked by someone who is expert in this area.
Yes, so even from young girls to adults, you need to know this is not something you should hide. This is very important for your health. So as she was saying, just be cautious. Always check yourself and make sure everything is perfect and there's no doubt about any of these issues.
Yes, this is important that you are not afraid. If you find any changes, it's better to discuss it with your friends or your mothers or your sisters, elder sisters. So anything that happening, you can just share it with any other woman around you. And then if you feel that, if they will tell you that it's something that you really needs to be checked, then you have to come forward and check it. And you should not say that ignore it and leave it and think that no, it will go by itself. So this is important that if you have any concern, anything, you have to be checked.
Thank you.
Thank you, Farzana. That was so knowledgeable. I didn't know at a young age that you have to be worried as well. But I'm going to continue from a question from their doctor.
Yeah.
She gave us beautiful knowledge. But is there any websites that they need to be aware to go and read about or to get any information here? What would you suggest, doctor?
Yes, certainly. There are multiple websites. There are breast cancer organizations in UK, in US, which if you search by www.breastcancer.org.uk or .us, you will certainly get the website which gives information for the patients, for the normal people. So it is always good to just go these websites, and please don't go on just Google randomly. There's a lot of misinformation, lots of myths, so just don't believe what everything is written there. You have to go to the right websites to know the right things.
Yeah, so that means not asking Siri, right? They always go and ask Siri.
Yes.
Now, actually, when doing a lot of research, I only thought that women get breast cancer. But then doing that, I realized there's a noticeable increase in breast cancer among men.
Yes.
So what do you think has contributed to this, doctor?
Yeah. In West, still the incidence in man is less than 1%. But in our area, in Gulf region, it is, and Asia, it is about 1 to 2%. So as we talked before about the genetic factors, intermarriages, family marriages, these are probably the main reasons, and what we are inhaling. We don't know about our environment, the processed food and all. I think in our part of the world, the lifestyle changes, the modifications of the food is a really important and the thing we should take urgent steps to do, because our mothers, our women, they are working, so they have lack of time, not enough time to cook for their children. So it's easier to just grab something, burger or something, or a processed food, and give to the children. So they learn the same thing, and they will be doing the same thing with their children. So this is very important. We have to save our future generations. So we have to take care of that from now, before it's too late.
So, doctor, going back again, with the previous questions with Farzana, so do you think that even men after 40 should go and get themselves tested as well, doctor?
This is what we are still, we don't have any defined guidelines for men at the moment. But yes, we do say to men that they should self-examine, and they should also be breast aware. And if they find anything different, any nodule, any lump in the breast, please come forward and get examined. Don't feel shy. This is again a part of your body. It is not just in women that they will get this problem. Men can also get it.
So, doctor, do they have men doctors who are breast surgeons in Hamad?
Yes, we do have.
Okay.
Half of the breast surgeons are women and half are men.
Okay, good. I
Yeah.
think they will want to know.
So they
isn't
can
it?
definitely come to man. Don't be shy. And believe you me, I tell you a story here. One of my patients, she was diagnosed with breast cancer, and while her treatment, her husband came along with her, and he said, "Doctor, I'm feeling a lump in my breast too." I said, "Okay," and we examined him, investigated him. He had cancer in both the breasts, and they both were cousins. He had cancer in both the breasts. And the girl, she had early breast cancer, and the man had advanced breast cancer. So that is the reason I say, please don't sit back. You need to come forward and get yourself examined too.
Yeah, I think then that means this video is, I mean, men also need to watch it, get yourself educated. So it's not only for females. I'm going to ask something to make it a little bit fun as well.
Okay.
You know why they have put pink and breast cancer? Do you know any combination why that is there, doctor?
I think pink goes with the ladies, probably.
Okay. So
they have different colors for different cancers, and blue goes for colorectal, and the ribbons there. So
okay, okay, doctor. So now I want to ask, on a serious note, what are the main treatment options that are available for patients, and does it change from country to country or region to region, doctor?
Right, good question. Now, treatment options, when we talk of treatment, we have to know what is the stage of breast cancer. And when we are talking of stages, we have early stages and advanced stages and late stages. So there are 4 stages of breast cancer. And first stage, it is just limited to the breast. In the second stage, it spreads to the glands under the armpit on the same side. In third stage, the size of the gland, the size of the tumor in the breast increases. And the fourth stage, it spreads to the rest of the body. So treatment depends on the stage at the presentation and on the type of cancer. We just say breast cancer, but breast cancer is many types. So we decide about treatments, we tailor-make the treatment according to the type of the cancer that particular patient has and what stage that patient has come to us. And the treatment decisions are made in a multidisciplinary team meetings, which are held every week in our hospital. And we discuss every cancer patient, and it is not an individual decision. We have surgeons, oncologists, pathologists, radiologists, our CNS, and lots of other staff. And we all discuss each and every case and make a tailor-make management plan for the patients. And there are certain guidelines which are almost similar across the world, but of course there are certain modifications depending on the institutional preferences. And cancer treatments are based upon, there are various treatments which comprise to control the disease. And it includes surgery, it includes chemotherapy, it includes hormone therapy, it includes immunotherapy, it includes special type of antibodies are given for certain kind of cancers, which is called target therapy. It includes radiotherapy, and so these all treatments, they combine to treat or control breast cancer. Sequence of the treatment is tailor-made according to the management plan of the patient. And there are various surgical options. Not in every patient we need to remove the breast. We are trying to save the breast. Now we save the breast in about 70% of the patients. And if you come early, you get diagnosed early, there are less side effects of the treatment, there's early treatment, patient gets better, and the prognosis is good. That means that the patients live longer. So that is why in this month, we really go for breast cancer awareness, that we need to be aware of the breast, and if there's anything, please come forward.
And doctor, I want to ask you something, especially this has been a very close question to my heart, because I've heard a lot of people back home in the villages saying, because when you hear the word cancer, they think, oh my God, it's terminal. So they think there is no reason to go and meet a doctor. I've got it, I'm going to die. That's the first thing, it's in their head. Secondly, they feel there is no complete cure. thirdly, they feel if they are cured, or they don't need to come and see a doctor because I'm fine. So these three questions, I know I'm asking you too much, but I want to get it out of the horse's mouth, they say, to get it from
Sure.
there. So,
Yeah.
would you be able to give me an answer for those three?
Yes. First thing, cancer nowadays, breast cancer is kind of considered a chronic disease. Okay, so if it is diagnosed early, and the patients can live up to 5 to 10 years, 100% of the patients can live up to that if they are diagnosed early. So it is not a terminal disease. So please don't get the same thing of the olden days that if it is a cancer, then it's all end of the world. It's not end of the world. You have a good life to live further. Right. Did I miss anything?
No, what I wanted to know was if they are treated and they are cured, is there a possibility that they can get it again? Can it reoccur again?
Yes, cancer can come back, and but the recurrence of breast cancer, in general terms, it is in 10 years' time, 90% of the patients will be fine, no coming back of cancer. Only 10% of the patients will have cancer come back. But these patients will be on lifelong surveillance. Once a patient is diagnosed with cancer, wherever they travel, they will be on lifelong surveillance and having mammograms everywhere, seeing a doctor once a year in survivorship clinics. So if there's any recurrence, that will be picked up early and treated early.
Thank you, doctor.
So actually, doctor was giving very good advice on stages, treatment, and survival. And we have to know survival is possible. You have to get it in the early stages and go through the process of the treatment, and you can survive and be free from cancer. So anyway, in general, I would like to know lifestyle choices. How can your lifestyle affect the treatment?
Yes, it's very important that we usually say that healthy lifestyle, and as Dr. Kulsoom mentioned, that modifiable risk factors. So healthy lifestyle choices can really improve, and in general, it improves the life expectancy and it improves the quality of the life. So for the same, to reduce the risk of breast cancer, or for the breast cancer survivors, that they can reduce their chance of recurrence of the breast cancer, it's very important that we go for the healthy lifestyle choices, which includes healthy diet, exercise, exposure to the to the sun in the early morning, and having fresh air. So all of these are healthy lifestyle choices. And similarly, we know that if you are consuming a lot of fast food, you are consuming a lot of alcohol and smoking and all, and these are the things that can affect your health in a very negative way.
Thank you so much for the good advice, and I would like to ask you, can you just tell us, you have experience in over 10 years, and with all your experience, what is the advice you give to general public? As doctor was saying, not only men also have the risk of getting breast cancer.
So the last advice that I would like to give is, as Dr. Kulsoom said, that many women are now breast cancer survivors, and as a breast cancer, after surviving the cancer and living in the community, it is very important that we support each other. So it's very important to be gentle, kind, and be able to understand what the other person is going through if they are diagnosed with breast cancer. So we have to really respect them and support them. And support can be in any way. If they are in the colleague in your work, or if they are the part of the community you're living in, or if they are part of the family. So any kind of woman who is diagnosed and going through the treatment, she will need a lot of support. And also what we have to understand is that some women, they are very good in expressing themselves, and they would really like to tell everyone that yes, they have the cancer and they finished their treatment, and that is okay. But there are certain women that they want to keep it to themselves and they don't want to discuss it openly and publicly. That is also their choices. So we should respect their boundaries, and we should give some space to those who don't want to discuss it openly and publicly. So my message final will be that if you know somebody around you who is diagnosed with breast cancer, who is treating with breast cancer, or who is living after this treatment of the breast cancer, we need to support them, and also we need to respect their choices and their privacy as well.
Okay, she was saying very important things. Support each other's boundaries and respect people. So we can, as a team, we can survive and go forward with this, right?
Yes.
So actually, that's a very brilliant message, Tushi and Farzana. Support is very important, and that's one of the reasons we are here in this platform talking about breast cancer. So I've got a doctor with a sea of wisdom, as you can see in the whole interview, and I'm honored and pleasure to know all these details. So I'm going to ask you the most important question, I think, out of all the questions is, because I believe prevention is better than cure.
Absolutely.
So, doctor, what would your advice be? But it's going to come in two parts. One for prevention and the other one for detection. So what would you tell the ladies or even men, your advice, doctor? Your golden words.
You have already said prevention is better than cure.
Yes.
Okay. So when we say for prevention, it is the first stage of prevention is that you do the measures that the cancer should not happen, and the second stage is that you have to detect it early, so the disease is controlled, and the patients could be a very productive people of the society, and they can continue in their lifestyle. They can be productive to the society. So my message for everybody, my advice for everybody is very simple: be self-aware and be breast aware. If you are healthy, your family is healthy, your future generations will be good. That's it.
Okay, thank you so much. Actually, I know we've got two prominent members of the Hamad Medical Corporation who are very busy, but they took their time to be here, not only for us, because of you. They wanted you all to listen, to you all to know the gravity of the problem that we are having in our community. And because it is like doctors and Dr. Kulsoom and Miss Farzana explained, that we can actually prevent it, or we can actually avoid it getting into a dangerous situation. So please take care of yourself, go and do all the checkup. And if you have any questions, don't hesitate to contact our team. We'll be able to, if we in any way, we'll try to help you all. So that is Chatterbox. From Qatar, it's in Instagram, it's in all the social media. And it's me saying bye to you, Hafi. And I hope you enjoyed, Doctor.
Thank you very much.
And I hope Miss Farzana enjoyed as well. And thank you so much for coming. Assalamu alaikum.
Wa alaikum assalam.
Okay, so thank you so much, Doctor and Farzana. We really had a very good session. I would say a fruitful session we had today. So all the women out there, please take care of yourself, watch yourself, and please follow the advice we gave you today. Thank you so much. I'm Tushi saying bye to you all.
Thank you.
I go on.